So there seems to be a major misconception amongst my friends on here that the US has a free market healthcare system. And since the US healthcare system is kind of shitty, we must switch to a single payer system. I mean, this doesn't pass any logical test, but okay, that seems to be what everybody believes. So first off, we don't have a free market system in the US, so this statement is automatically false there. We have a highly regulated form of crony capitalism or capitalism that benefits the people with influence and costs a ton of money. A true free market system would dramatically lower the cost for everybody. So what I want to do is I want to talk about France and the UK's healthcare system, the two countries that I probably know the most about besides the US. I know there are other countries that have similar healthcare systems, Canada, Germany. Brian just posted a thing about those two. I actually think Canada and France pretty well run similarly, and I think Germany, Britain pretty well run similarly. I could be wrong about that, but I don't know much about Germany's healthcare system, and I know quite a bit about Canada's. It's like a crappier version of what France has. So I'm going to talk about that, and then I'm going to talk about what I see are the problems with the U.S. system and what a free market healthcare system would look like. So first, let's talk about France. So France has a true single payer system. What happens in France is everything is regulated from day one. You go to medical school. Now, you don't pay to go to medical school, so taxes are higher there. Okay, that's fine. You go to medical school. You don't get to pick what you focus on necessarily. You get, shoved into whatever profession they feel that you are best capable for. And there's some arguments for that. I'm very pro freedom, so I'm against that. But okay. And then you become a doctor, and then from that point on, everything about you is regulated. The government sets your prices, the government sets your wages. All of this stuff is regulated by the government, although not specifically run by the government. Then the government does the same thing with pharmaceuticals, with companies that develop technology, hospitals, all of this stuff. Everything's regulated the same way. Then the government provides health insurance for everybody. It's called Medicare, it's called Medicare, I believe. That's the word they use over there, the French version of that. And everybody pays, or everybody gets up to 100% of costs covered. Basically, you get 70% for routine things, and 100% for chronic or emergency situations are covered by your government provided health care or health insurance. And then you have the option of buying supplemental health insurance, which is actually a pretty free market thing that they have going on over there, where they have all these different health insurance companies that compete. Thus, they drive down the cost, they provide more things, and they're competing with each other in a somewhat free market. Costs go down, they provide better things, people buy those. 90% of French citizens have that. That supplements the cost. And the end result is you get a pretty good product and you don't pay very much up front or out of pocket. You pay it in other places. I mean, you're still paying the bill. The bill still comes, and then you're dealing with the downsides of having a single payer system, and that's rationing of care. France has a pretty good system. According to the WHO, they have the best system in the world. And so rationing doesn't happen as much as it happens in Canada or the UK, but rationing happens. You can't just get unlimited healthcare forever. You can't get everything that you want. You're not going to get necessarily the top shelf care. You're not going to get the same care if you came to the States and had the same operation. You're just not. The care here is better than the care there. But you're going to pay far, far less for the care there. So you're paying a lot less money for slightly substandard care. And then the French have basically systems in place where if you're very poor, everything's covered. Again, if you have chronic illnesses, everything's covered, which is kind of ironic to me that the people who use the most healthcare pay the least, but whatever. And overall, I would say that the French people seem to be pretty happy with their plan. I mean, approval rating for it is in the 90%. And it is what it is. It's a decent plan for France. France isn't the US. It's a decent plan for France. It works very well for what they want. Conversely, people pay outrageous taxes. There are wait lines, if you have cancer or whatever, I mean, you have to wait. If you need a CAT scan, you have to wait. Things are rationed a little bit. Again, taxes are really high. Taxes are really high across Europe anyways for a variety of reasons. As France continues to let more and more Asians in, they probably experience more backups with their healthcare system because there are just going to be more people while not increasing the taxpayer or the tax revenue, but that's not going to be a problem right now. So that's France. Now Britain has true socialized healthcare. Britain has the National Health Service, and basically it is government provided healthcare. So you don't get insurance. You get everything is paid for by the government. So the government runs everything. Now, granted, the government contracts things out to private hospitals and whatever, but the government takes your tax dollars and then they fund hospitals, they fund doctors, they fund all this stuff. They set all the rates, and then you go get the care that you need. The downside to this system is that while it's one of the cheaper systems, I mean, it's below the world average in spending per person, their healthcare sucks. I know you talk to British people and they'll say it's not true, but it just is. The life expectancy rate of people with cancer in Britain is far below any other country that's considered a modern country. You don't get the same level of care that you get in any other modern country. Wait lines are outrageous. A lot of drugs aren't available. They're just not made available. People in the UK say that when they go to the hospitals are dirty and they're overcrowded and you don't get private rooms and all of this stuff. People go to the hospital and you get sick from going to the hospital at a much higher rate in the UK than say here in the US. So, I mean, I know hospitals are generally gross places because they're full of sick people, but they're even more dirty. So there are lots of problems with the British healthcare system. Now, all of that is not to say that the U.S. healthcare system is good. The U.S. healthcare system sucks. It sucks because of the government. So the government mandates things that just don't need to be mandated. Health insurance. So health insurance, just like any other insurance, is where this party is betting that you're not going to use the insurance and you're betting that you will. And as long as that dichotomy is a complete free exchange, it works very well. So let's say I wanted to start an insurance company in a truly free market situation, meaning there's no government regulation at all. What I would do is I would tell people that, hey, I'm going to offer you car insurance, and I'm only going to cover accidents, traffic accidents. I'll cover act of God things like a tree falls on your car while it's parked. But I will not cover vandalism or theft or whatever. I'll just set rules like this is what I cover. This is what I do not cover. Do you agree to these terms? Yes or no? You say yes. And then I say, okay, now I'm going to charge you, or I'll pay to fix all but $500 of your car if you pay $50 a month. But if you pay $60 a month, I'll pay the 100% price of fixing your car in the event that it's damaged. You agree to these terms, we sign a contract, and then I do this with, say, 1,000 people. Now I'm collecting, let's say, all 1,000 people, just for the sake of easy math, all 1,000 people that I do this with take the $500 deductible plan. So every month, let's say that I collect $50,000 a month, and let's say that every month one person, or 0.1% of my base totals their car, and the average cost is $35,000. And let's say that two other people get involved in accidents and the average cost is $5,000. So that's $45,000. I'm still making $5,000 a month. I use that money for operating costs, and then I take some money for me and live happily ever after. Every month this happens. Those are the averages. Some months are better, some months are worse. That's how insurance companies win. You as the individual are paying a small amount and potentially getting thousands of dollars in exchange. Me as the insurance company am getting thousands of dollars and potentially paying thousands of dollars. Both sides are winning in the argument. Now, let's say that the government cracked down and said, hey, Trevor, you have to pay for people if their car is vandalized. And you have to pay for people if their car is stolen. And you have to pay for people if they are negligent and they crash because they're drinking and driving. And let's say I have a specific clause against that. And whatever. Okay, so now those same 1,000 people, if you add in these extra events, are more likely to be making claims against me. So that's going to bump up the likelihood of me having to pay out, which is inevitably going to force me to pay more money each year, or each month, each year, whatever. And so because of that, I have to now raise my costs in order for me to make a profit, because nobody starts a business to not make a profit. That's just not how that works. You start a business to make money. Like you invest your time and your effort and your capital into something that's going to profit for you, or else why do it? I mean, I know that in today's society, like the idea of making a profit has become a swear word, but it's not. It's what you do. So now I have to raise my rates. Now let's say the government comes along and says, oh, here's the new thing. You have to raise your rates. You have to cover people who have already been in an accident. So if Joe has a car and Joe crashes his car and then he calls me, I have to by law provide him the same plan and I have to cover his damage to his car that has already happened. So now Joe has no incentive to buy insurance ahead of time. Joe is going to wait till he gets in a car crash, and then he's going to call me, and then he's going to want me to pay $40,000 for his Mercedes, and I'm out more money. So the only way I can protect myself against that nonsense is to raise my rates dramatically and expect that my higher risk drivers will stay on with having insurance anyways. I'm probably going to lose some of the lower risk drivers, and I'm going to have to pay for all of these people. So that's pretty crazy. The other thing it might do is it's going to change the way that and let's say they take it another step forward. Let's say that my insurance policy said that if you use your benefits, then I'm going to raise your rate to $100 a month for the next year until they go back down. And let's say the government says that that's illegal too. So this is going to change people's behavior. People are going to start being a little more careless when they drive because there's less penalty because they're paying the $50 a month regardless. And so where's the incentive to take care of their thing? Where's their incentive to be careful? And this is kind of the major problem with the U.S. healthcare system is it's not free market. On top of that, then there's things like Medicare and Medicaid that come out, and they are plans where you're poor or you're old and you need more care, I guess. Young people don't really need more care. That's a misconception. But either way, you're old or you're young and you get government-backed healthcare that says, hey, we're going to only pay X amount of dollars for said procedure. So you have a knee replacement surgery, and we're going to pay $40,000 for that knee replacement surgery, regardless of how much that knee replacement surgery actually costs. Now, some doctors accept that $40,000. I'll take that. Some doctors will not. And so that makes care less available. If, like in France, you don't have the option of saying no. So every doctor will accept that $40,000, and that's just what they get. In the long run, if that becomes the rule, then that would disincentivize becoming a doctor to some degree. Some people in America, obviously, you don't get free healthcare or free education. If you start getting free education, then the cost of everything goes. The solution is a free market solution. So I've already explained how free market insurance would work. I'm a 34-year-old man. I don't need maternity care. I'm a pilot. I don't use recreational drugs. I'm never going to use recreational drugs. I don't need rehab care on my insurance. I don't need to pay for that. It doesn't make sense. It's not a thing I would normally purchase. I would elect to not pay for a lot of things that I would not pay for, and then the insurance company would be selling me a cheaper plan. My plan would be would be less expensive. Instead, what happened when the ACA passed? Well, I was a flight instructor. I was making about $3,400 a month. I lived in Alaska. And the bronze plan that was available on the Alaska marketplace for a 34-year-old male, single, who made $3,400 a month, cost $1,800 a month. That is not an exaggeration. That is absolutely outrageous. How the hell can I afford that? Why? That's 50% of my income for something that I will never use because I didn't go to the doctor. I go to the doctor once a year out of pocket to get a flight physical because I need to for my job. That's all I do. I'm a relatively healthy guy. I mean, it's not perfect, but I'm not going to go to the doctor, and I don't feel the need to go to the doctor because my knee hurts, and I take some Advil and I drive on. I don't need to go to the doctor because I didn't sleep well last night or something. I mean, you have bad nights sometimes, whatever. People go to the doctor because their kid has a runny nose, and people abuse the system. So the other thing that happened is for some reason we started using healthcare insurance or health insurance to cover routine things. So you used to not go to your insurance company because you went and had a physical or some preventative thing or just a regular doctor's visit. Like your insurance covered things that cost a lot of money, but they didn't cover routine things that just didn't cost a lot of money. But what happens is now doctors have to accept insurance. So because they're accepting insurance, and then because the insurance is provided by the government in some cases, then they have to abide by all kinds of government rules and do all of these extra things. Then they have to hire more people. They have to hire more staff. Their cost goes up. They have to pay. I mean, the other thing that happens in America is malpractice lawsuits are outrageous. So there's malpractice insurance, and that's outrageous too. So doctors have to pay for that. And doctors paid a shit ton to go to college because the cost of college is going up. So they're paying that back. I mean, at some point, like doctors still have to make money. If you're going to spend that amount of time and that amount of effort and those amount of electrons in your brain to become this thing, like you want to profit from it. I know that you want to help people, and all doctors want to help people, but they also need to take care of themselves. Like some people become doctors purely out of the goodness of their heart, and they give away their trade, and they're allowed to. Some doctors understand that working for less and getting experience will help them out in the long run. Like Ron Paul, when he first became a doctor, took a job making $3 an hour at a church-run hospital. He made that choice, but then he opened a private practice and he charged like $5 for a hospital visit or for a doctor visit. But when you have to start taking insurance, cost goes up. When people can't compete, cost goes up. So the Surgery Center of Oklahoma is a place I like to always point to. Free market. So these are doctors who refuse to take insurance, and because they don't take insurance, they don't have to abide by a ton of other things. So they keep their costs low. You go have a knee surgery or a shoulder surgery. I looked it up last night. A rotator cuff surgery is like $6,400 or something. So you go have your rotator cuff surgery, and then they send you an invoice. And this is what it is. You paid X amount of dollars for facility fees, and you paid for the hardware that's in your shoulder, and you paid X amount of dollars per hour for the doctor, X amount of dollars per hour for the nurse, X amount of dollars for these things, and it's broken down very easily. Whereas if you go to the hospital and you see an orthopedic surgeon through your healthcare company and all of that, by the time you have your rotator cuff surgery, you've paid $100,000 or more. Well, you haven't, but your insurance company has. And because your insurance company just paid $100,000 for something got $6,000, they have to charge more. Free market solutions would drive down costs for everybody. And the other thing that they do is this notion that it hurts poor people. No, it doesn't hurt poor people. Poor people still get care. Poor people can still get care. If the cost is lower, then hospitals and other businesses would give away their services for free much more likely. I mean, hospitals want to help people. You see Jimmy Fallon. Is it Jimmy Fallon? Who's always talking about his son who got care at the Surgery Center of Los Angeles or the Children's Hospital of Los Angeles. Turns out the Children's Center of Los Angeles, in fact, the doctor that did his treatment, I forget his name, does hundreds of surgeries each year for families of illegal immigrants who aren't covered by Medicare, who aren't covered by insurance, who he's just doing it for free because the hospital is a charity organization, and the charity organization gets hundreds of thousands or hundreds of millions of dollars in grants and in donations and whatever, and they use that money to provide these services for people. You know, sure, Jimmy Fallon can pay to have his child treated, but other people can't, and they still get the same treatment there. So it's just a fallacy to saying that doesn't happen. You don't need the government to be involved in things. The government hinders progress. The government gets involved, and then it turns into a bureaucracy. And then they start making rules, and they start limiting things, and as soon as you start limiting things, you start driving the cost up. As soon as you start making rules that prevent people from competing, health insurance companies can't compete amongst between state lines. Employers must provide health insurance, blah, 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 blah. All of these things, when there's a must put in there, or can't, either or, then what happens is that limits what the people can do. And I got it. You know, there are some people who take advantage of poor people and all of that stuff, but that's not most of these people. That's not most people in business. And on top of that, you look at what happens in the current system. So Congress, the members of Congress don't have to have the same rules and the same restrictions that on their healthcare insurance that pertains to me or pertains to you, because Congress works with these people and creates special rules and creates special tax loopholes, and they're like, hey, we'll scratch your back, you scratch our back. But in a true free market society, there's none of that. There's no paying off the congressman to give you special treatment. So if you're the asshole who buys said drug and jacks up the prices, then that incentivizes other companies to find a drug that does the same thing to lowball you. Because when you lowball somebody, you get all the business. If Dr. A, let's say Dr. John is an orthopedic surgeon and Dr. Mike is an orthopedic surgeon, and Dr. John agrees to do your ACL surgery for $26,000, and Dr. Mike knows about this, then Dr. Mike is going to start trying to undercut that or start offering better care so that he can get business, because people are going to go see Dr. John. That's how the market works. It incentivizes you to keep your prices low and to offer better service. The government coming in, all it does is causes more people to put themselves in jobs and put their friends in jobs, and so you get a big bureaucracy full of people who aren't qualified to do these jobs, who in a free market situation, the job doesn't exist. And then they're obviously not incentivized to make the system work any better, because they would be getting rid of their own job. So I hope that makes sense. I hope it's logical. I did kind of ramble here a little longer than I wanted to. So have a good one. Bye.